But I'm also curious to understand your view on the pharmacodynamics and pharmacokinetics, the PDPK in Ayurveda. What do you have to say?
Yeah, so this is like my another favorite topics to correlate and discuss. I think Dravya Guna is incomplete without us correlating with pharmacodynamics and pharmacokinetics and its understanding through an Ayurveda perspective. Uh, I think till the discussion that we had till now, we understand that Ayurvedic formulations are crafted with precision. And when we talk about how Ayurveda deals with root causes and not just the symptoms, we mean this, that the formulations act at multiple levels and they help in reversing the pathology of the disease and not just the symptoms, right? So there is a comprehensive understanding of pharmacodynamics and pharmacokinetics, uh, which is expressed through the unique terminologies and principles that we had just discussed. We started with virya, the concept of virya.
Yeah.
And when we infer pharmacodynamics, we refer to the effects of medicinal substances on the body and its doshas. Uh, Vata, Pitta, and Kapha. Pharmacodynamics is what the drug or the herb does to the body, what it does to Vata, Pitta, and Kapha. So here the
Yeah.
concept of virya, Dr. Usha, is very central to understanding pharmacodynamics. Virya is representing inherent potency or energy of the substance. And Ayurvedic pharmacodynamics is huge. It considers the effects of the herbs on the not just the agnis, which is our digestive fire. It considers the effect of the herbs on dhatus, which is the tissues, and different herbs possess different qualities, different taste, different post-digestive effect, influencing the doshas and contributing to a bigger therapeutic or a synergistic therapeutic impact, like you just said. On the other hand, pharmacokinetics. This involves a study of how, to the listeners, this involves a study of how the body processes and absorbs the herbs or medicinal substances, right? So this is linked with the concepts of rasa. This is linked with the concepts of vipaka and prabhava, so special potency. So taste determines initial effect, what is going to happen, and vipaka or the post digestive effect dictates its long term impact, like what will the herb do on a long term basis in a patient. And Ayurveda recognizes that there are different pathways of absorption, emphasizing proper preparation of the formulation and proper administration methods of the formulation, which will help in proper assimilation of the medicinal compounds, and it will help in giving us the desired result even in chronic conditions. So when we create a herbal formulation, we aim to strike a balance between pharmacokinetic factors, ensuring that the formulation is efficacious, and we also look for minimizing potential side effects. So the synergy that we just spoke about till now of various herbs and the formulation is crafted with a very deep understanding of pharmacodynamics and pharmacokinetics. And that is why we say that Ayurveda's holistic and personalized approach to healing is rooted with understanding of this pharmacodynamics and pharmacokinetics, Dr. Osha. I hope this was not complicated.
Oh, yeah, no, it was actually very, very well said and very detailed as well. And I think I would like to thank you for sharing this with our listeners and making it clear between the differences between PD and PK or pharmacodynamics and
Yeah.
pharmacokinetics, where we are talking about the mechanism action plus also what happens once the drug is taken into the body, what happens to the drug and how is it absorbed, distributed, eliminated, all that involves in the pharmacokinetics, right? When we talk about it. So I'm absolutely very well. I mean, like I said, I keep learning more and more. So and I also understand that it's profound science behind all these Ayurvedic combinations. It's important to understand PDPK or pharmacodynamics and pharmacokinetics. And it also includes understanding, like I said, mechanism of actions, interactions with the biological systems, the physiological responses that these herbs elicit in our bodies. And so how these herbal treatments are tailored to the individual needs and constitution. I think that's what you explained very well. And also, I think it also takes into account like the age, the gender, the season, the environmental influences. A lot of things go on into creating, I feel, these herbal combinations. And I feel the PD, or the pharmacodynamics of Ayurveda, emphasizes the importance of using these herbs in the dosage as well, right? Just to add a little bit to what you said, the correct dosage, how long, like when we were talking, you were talking about ashwagandha, the duration is very important before it becomes even more heating to the body. You need to like take it out to achieve that optimal therapeutic outcomes. Otherwise, it will become, there will be side effects, right? Just like
Correct.
any other. And these herbs can only be also how they're administered, right? Like there are various forms of dosage forms. Like it can be a powder. They make decoctions. They make oils. So when I first started looking at it, I was like couldn't wrap my head against it. Like, okay, it's the same herb. Now there's a tincture. Oh, there is the oil. There is the pill. There's a powder. And so it was kind of very complex. But I finally navigated myself through Dravya Guna and understood a few words as well, like arishtas and, what are all those things. Lepa, there are terms which we use for all these. And the absorption of these herbs also depend on other factors, like including the kind of herb, of course, which we talked about. The route of administration is also
Correct.
thought through, like whether it's
Yeah.
a pill or a topical. Are we applying
Yeah.
or are we inhaling? All this
Yeah.
is thought through. And then I feel the interactions of these substances are also something that we Ayurveda actually emphasizes a lot. For example, like some herbs can be absorbed more efficiently if it is taken with an oily kind of a substance, while others can
Anupam.
probably
Yes.
be taken. So there is all that, right, is goes
Yeah.
into it. So I found all that to be very unique to Ayurveda. Of course, it was a lot of learning and very complex and very complicated. You have to wrap your head against it and spend hours, but was very powerful. I felt like how the vehicle is important, and how it vehicle has also been described. That's what I
Correct.
call, because in that's what we say, the term vehicle. So integrating, I feel that traditional science with modern research probably would unlock new possibilities, new pathways for the medicine for the field of medicine. And this traditional knowledge and the clinical experience that already exists for these herbs in Ayurveda, I feel it's a valuable it's a very valuable documentation that is already there. And we already know how it is absorbed, how it is distributed, metabolized, eliminated, which you just mentioned about a few herbs, right? And I feel a deeper understanding of the PK of Ayurveda can also help optimize. Maybe we can do a little bit more PK studies or something, but it can
Yeah.
optimize.
Yeah.
I mean, the therapeutic use. I mean, what else can it be used for? How safe it is? When to start? When to stop?
Correct.
And also, the efficacy can be enhanced maybe by using some other combinations. I mean, there's a sky's the limit if we want to do that. And of course, I always want to emphasize that using these herbs appropriately is a very important thing. Just because somebody read ashwagandha is like this or something is not the way to go.
Yeah.
I don't know what you have to say.
So uh, you've rightly summed up. It is when we talk about synergy of herbs in Ayurvedic formulations, this is a testament to how rich our traditional knowledge is. Uh, I mean, people will be really fascinated and surprised as they go deep into the concept of Ayurvedic pharmacology. So I think that is it is a bridge between ancient wisdom and today's modern science. And that is why Ayurveda's approach is very comprehensive to healing. I think that's what I feel, Dr. Usha.
Yeah, totally agree. And I think a number of studies have been done, which I read all the time, is helping and adding more value to these formulations
Yeah,
and all the science that is already exists. And I think Ayurveda really embodies holistic healing by targeting those illness origins and reestablishing that mind-body equilibrium, right? And
yeah,
that's the goal here. And I think like you just said, the customized therapies, preventative healthcare, all this establishes like how already it was advanced in some sort, like for the
Correct.
holistic healing
Yeah.
of a person. So thank you, Dr. Aditi, for enlightening us on this very intriguing subject. I think we can talk hours and hours on this, I feel.
True.
Um, and I think I do really appreciate your presence today. I think it was very, very interesting. And my brain is working like, oh, wow, what about this? What about that?
Yeah.
And I think we can discuss those subjects down the road one day about even just talking about virya or prabhava is like so much. There is a whole hours of podcasting or talking we can do. It's such a captivating topic, any of these. And I would like to thank all our listeners for tuning in. And remember to subscribe to our YouTube channels. And we would love to hear your feedback in the comment section. Thank you.
Thank you, Dr. Usha.